So many times that things are going on in our bodies that we just can't explain. What you think is just another headache could actually be something worse. We're talking this morning about brain vascular malformations. And joining us now is Dr. Andrew Carlson, the Assistant Professor of Neurosurgery with UNM Hospital. Doctor, thank you for joining us.
Thanks for having me.
So this can sometimes be pretty scary stuff. Everybody gets a headache. You know, we're always taught, especially being aware of strokes and things like that. So first, tell us what brain vascular malformations are, how do they form, and just a bit more information about these.
Absolutely. So most people are familiar with brain aneurysms, which can bleed and cause strokes. Brain vascular malformations are more uncommon than brain aneurysms, but they can also cause problems like stroke, seizures, things like that. And as our technology is advancing, we can treat more and more of these lesions. Some of them are very benign and don't even need treatment, and some of them are very high risk and should be considered for treatment. So we're talking about things like arteriovenous malformations, fistulas on the surface of the brain, cavernous malformations. Those are all the kind of things that we treat as far as vascular malformations.
Okay. Now you said that, sometimes it doesn't have to involve surgery, sometimes it's just observation and treatment. How do you gauge that? Do you decide when we need to go in and do something or that we can just treat it with medication?
Absolutely. That's a great question. So we have pretty good data looking at long-term results on these patients, and some of them have very low risk of bleeding. Some of them have higher risk of bleeding, causing seizures, other problems. And so trying to weigh what the risk of a treatment versus the risk of that lesion is the decision-making process in terms of whether or not we decide to intervene.
Gotcha. And of course, the intervention, the surgical intervention, open brain surgery, which can be very scary. Does it always have to be open brain surgery? Are there other ways that we can treat it?
It doesn't always, and that's actually been some of the biggest development that's happened over the last decade or so, is that many of these lesions can actually be treated in different ways, sometimes with just a focused dose of radiation. Sometimes we can actually go up inside the blood vessels and put tiny material inside to the arteriovenous malformation or inside to the fistula and seal it up, glue, coils, things like that.
Gotcha. And it's also, I understand that some of the new technology, we go in through the leg to treat something in the brain.
Exactly.
Right? Okay.
And so it seems a little bit strange to think of that to start with, but most of the time when I go up to arteries inside the brain, I would start out in the artery in the leg because everything sort of gets connected back up. And using various shapes of catheters, we can get all the way up to the tiniest vessels of the brain. And some of the tiniest catheters that we use are smaller than a human hair. 8/1000ths of an inch are some of the tiniest wires that we use to get up into these tiny vessels.
No kidding. Wow, that is tiny. And this is something that can be treated for patients of all ages.
It's true. Sometimes very young children present with these kind of problems, and I've treated newborn infants with problems where their hearts were failing because of these kind of lesions, all the way up to very elderly patients who have problems with whooshing sounds in the ears and things that are very disturbing, and it can really improve their quality of life to try to decrease the flow through those lesions.
That's great. Well, doctor, this is really important information. Thank you for coming in, and we, of course, will have links on our website at krqe.com under the CASA tab. Thank you again for coming.